Radiation sequelae in head and neck cancer and dysphagia in adults. What is radiation sequelae in head and neck cancer?
To understand what radiation sequelae of head and neck cancers are, we must first understand the parts that make them up. Head and neck cancer are cancers of the squamous cells that line the oral, pharyngeal, and laryngeal structures. Radiation reduces cellular reproductive activity within these squamous cells. Radiation is a common treatment for head and neck cancers, in addition to chemotherapy and surgeries. Radiation sequelae are basically the ramifications. They're the negative effects that occur after a disease or condition, in this case, the condition being radiation. These effects can be acute, meaning they last 2 to 3 weeks after the radiation. They can be chronic, or they can be late effects, meaning they manifest anytime after and often worsen with time. Here's a list of a couple of the effects. It includes serostoma, which is changes in volume, consistency, pH, and production of saliva. It also includes mucositis, which is the painful inflammation and ulceration of mucosal linings. This often results in a thick mucosal secretion. Aspiration is often silent within populations that receive this radiation because of sensory deficits within the pharynx, larynx, and the mouth. Atrophy often occurs because of disuse. Fibrotic tissue, including scarring, occur in the mucosal and submucosal linings of these structures. Range of motion is also restricted within the tongue-based retractions, pharyngeal constrictions, hyolaryngeal elevation, and the UAS opening. Within these restrictions include trismus, which is reduced mobility within the muscles and the joints of the jaw. Changes of skin are also a noticeable effect. That includes sensitivity at the site of radiation and changes within the mucosal epithelium inside of the mouth and the pharynx that often lead to irritation. Some general ramifications of radiation from head and neck cancer do include nausea, neuropathy, and pain that can be because of the treatment or because of the cancer itself. Some of the ramifications of head and neck cancers specifically include dystonia, taste dysfunction or altercations, and overall difficulties within breathing and swallowing coordination.
What is the incidence and prevalence of rHNC? Incidence of head and neck cancer globally is around 550,000 cases annually. This is twice as high for men compared to women. Incidence of head and neck cancer in the United States varies depending on which source you use. According to the American Cancer Society, in 2022, 54,000 new cases of head and neck cancer arose in the US alone. While oropharyngeal cancer caused by smoking and tobacco use is down, increases have been tied to HPV, or the human papillomavirus, which is the most commonly sexually transmitted infection and can lead to oropharyngeal cancer. HPV has higher survival rates, and radiation therapy is standard treatment for head and neck cancer, meaning more people are living with the long-term effects that we're discussing in this presentation as compared to previously. Of the people with head and neck cancer who receive radiation therapy as treatment, about 45%, so almost half, will develop dysphagia as a side effect. That is a super high statistic. So if you're working in a medical setting, you're bound to have clientele in this area. What are common comorbidities of rHNC?
Common comorbidities within the radiation of head and neck cancers occur within all types of radiation. These conditions include neuropathy, taste impairment, and speech impairment. HPV has been identified as a factor and a comorbidity because it occurs in many types of oropharyngeal cancers. Within these comorbidities, the ones with rates that are expected to increase and be more commonly found within this population over time include anemia, hyperlipidemia, COPD, depression, and pneumonia. Within the hepatic diseases, the ones associated with head and neck cancer include hepatitis viruses B and C. Some comorbidities that you are least likely to encounter but that do still occur within this population include chronic kidney disease, cardiovascular disease, and cerebral vascular accidents. Age is somewhat of a factor. For patients that have head and neck cancer and receive radiation, those that are 60 or older are likely to experience many more comorbidities than those under the age of 60.
How does radiation of head and neck cancer impact body systems? First up, we have the neurological impacts. So we all know by now that the brain is the control center of the body. This means that when the brain is affected by something, it's going to cause a sort of chain reaction affecting other body systems as well. Head and neck cancer poses a greater threat to the neurological system simply because of its location as opposed to other kinds of cancer. Unfortunately, radiation can negatively affect the central and peripheral aspects of the nervous system. The neurological symptoms are usually long-term side effects, so it takes a while for them to develop. When talking about the brain itself, there's a specific structure that, when damaged during radiation, is correlated with cognitive impairments, including memory loss, and that would be the hippocampus. Because the hippocampus is located where neurogenesis occurs, it is more radiosensitive than other brain structures. Another central nervous issue is transverse myelitis, or inflammation of the spinal cord. This causes something that's referred to as Lermidis sign, which is an electrical shock-like sensation that happens when the person affected flexes their neck, like this. This feeling radiates down through the spine and into the person's arms and legs, which is extremely painful. When it comes to the peripheral nervous system, no nerves are safe from damage. This includes the auditory nerve, which can, when affected, can cause sensory neural hearing loss. This also includes the phrenic nerve, which Kristen was just talking about in our Med-SLP class this week, and I was like, whoa, I've just been researching this. So the phrenic nerve provides motor information to the diaphragm, which when affected can result in partial or complete paralysis of the diaphragm. As we've learned, breathing and swallowing are highly interconnected, so breathing issues are also going to become swallowing issues. But more on that later. Upper airway impacts.
Next, I will discuss the upper airway impacts that radiation of head and neck cancers have on the body. It should be noted that the typical schedule for radiation therapy occurs 5 days per week for 7 weeks, where the patient receives a total of 40 to 80 grays. Radiation can alter the mechanisms and the anatomy of critical structures that are involved within swallowing. Normal tissue complications increase by 50% within these structures when a patient receives 50 to 80 grays or more. There is also a general radiation threshold that, whenever it is surpassed, the patient is more likely to receive more likely to have problems within swallowing and dysphagia. The threshold for pharyngeal constrictors are 50 grays or more, and the threshold for the larynx is 20 grays or more. There is some impaired safety that should be noted. There are some sensory deficits within the mouth and pharyngeal walls. Serostomia and mucositis do allow for poor lubrication and unsuccessful transport from the mouth down to the stomach. Fibrosis also occurs within the mouth, pharyngeal walls, and the UES. When it occurs in the UES, it restricts the size and the duration of the sphincter opening, and this can contribute to residue accumulation. All of this leads to impaired safety through poor airway protection and increased rates of aspiration before and after the swallow. There is also some impaired efficiency, including inadequate bolus containment, transport, propulsion, and overall leading to increased amounts of residue that are left behind. Atrophy of the suprahyoid muscles occur, along with atrophy of the muscles of the floor of the mouth, including the mylohyoid. Overall, discoordination of breathing and swallowing are very common.
Cardiopulmonary impacts. Vasculopathy describes any sort of disease that is affecting the blood vessels. Radiation vasculopathy is when it's caused by radiation. Carotid artery stenosis is just one kind of radiation vasculopathy that can occur. You have two carotid arteries. You can feel them on the sides of your neck. So carotid artery stenosis results from a blockage or narrowing of the carotid arteries. This typically develops 2 to 3 years after radiation therapy. 21% of survivors will develop carotid artery stenosis within 5 years post-treatment. This can cause blood clots to form in this area, which can then lead to strokes. Harmony had briefly mentioned how fibrosis restricts the size and duration of the UES opening for the upper airway. While not super common, this can also happen to the lungs. This is called pulmonary fibrosis, or scarring in the lungs, which can impact how the person breathes and gets oxygen into their blood. You might be thinking to yourself, okay, Sam, this all sounds terrible. How can you tie this back to dysphagia? Well, as Angela Monsolio details in her MedBridge presentation, the essentials, dysphagia, and head and neck cancer, any problems with breathing are going to inherently affect the breathing swallowing pattern because of the inverse relationship between breathing and swallowing. People are always going to choose to breathe over choosing to swallow. So, yet again, we have another aspect of how the radiation effects for those with head and neck cancer are having havoc wreaked on their body, even years post treatment. Gastrointestinal impacts.
Now to discuss gastrointestinal impacts of rHNC. Gastrostomy tube feedings are safe and should highly be considered as a way of supplying nutrition to those with radiation of head and neck cancer, especially when this radiation is paired with chemotherapy. This tube feeding can be and should be set up prophylactically, opposed to being set up on a need basis, when the patient can no longer rely on swallowing as a safe and adequate means of supplying themselves with nutrition and hydration. Gastrointestinal mucositis, along with oral mucositis, are some of the more common side effects of radiation therapy. They can progress to become painful ulcers. In an earlier slide, I mentioned that gastrointestinal diseases are comorbid with radiation of head and neck cancer. I touched on hepatic diseases, but I did want to mention others, including ulcers, diabetes, chronic liver disease, and chronic pancreatitis. It should be noted that weight loss is very common during this treatment, regardless of tube feedings and any other feeding methods that are used.
Summary, references, and resources. So to summarize what we just went over, the global incidence of head and neck cancer is about 550,000. In the US, it's 54,540. And of those people with head and neck cancer who receive radiation treatment, about 45% of them will have dysphagia. Some common comorbidities include HPV, hypertension, anemia, COPD, and depression. Neurologically, radiation therapy can affect both the central and peripheral nervous systems. The central nervous system includes structures in the brain, such as the hippocampus, that affects memory, as well as inflammation of the spinal cord. Some of the drastic peripheral nervous system effects include damage to the auditory nerve, which can cause sensory neural hearing loss, and the phrenic nerve, causing complete or partial paralysis of the diaphragm. When it comes to the upper airway, xerostomia, or diminished saliva production, as well as mucositis when the mouth is sore and inflamed, are extremely common side effects experienced by those receiving radiation therapy for head and neck cancer. Those factors, along with fibrosis and atrophy of the suprahyoid muscles and muscles of the floor of the mouth, are huge contributors to the reason why dysphagia is so prevalent among this population. For cardiopulmonary effects, diseases affecting blood vessels caused by radiation therapy, also known as radiation vasculopathy, leads to high rates of carotid artery stenosis, which can result in blood clots and strokes. Fibrosis is caused by the chronic inflammation process induced by radiotherapy, and when that tissue scarring occurs in the lungs, you can get pulmonary fibrosis. These cardiopulmonary issues can be tied back to dysphagia, as breathing problems inherently affect swallowing in the breathing swallowing pattern. For the gastrointestinal effects, gastrointestinal mucositis, which can progress to painful ulcers, is experienced often by head and neck cancer patients being treated with radiation therapy. Also, when the patient can no longer rely on swallowing for safe and adequate nutrition and hydration, a common intervention is the use of a gastronomy tube. Other than that, please find our references and resources posted on the discussion board. Thank you. We look forward to reading your comments and answering your questions this week.